Hi guys, so for today we will be discussing the compliance, legal and ethical issues, which is chapter 12 of your book by Lynn Howalke, the complete textbook of phlebotomy. So kung may question kayo, PM me na lang sa Canvas. Okay? So we will start by discussing the objectives. So one of our objective is to explain the law and regulate the compliance. Discuss why it is essential for the laboratory to maintain compliance and follow these laws. So dito sa Philippines, maraming pinagko-compliant ang mga laboratories. Lalong-lalo na sa DOH natin. Na siya yung nag-regulate ng mga rules ng ating mga laboratories and hospitals. So as a laboratory staff, kailangan meron tayong mga iwasan to avoid injury-related lawsuits. So we will discuss the best way for a phlebotomist to avoid injury-related lawsuit o yung kinakasuhan. And we will also define ethics and describe yung mga situation where the phlebotomist would need to make an ethical decision. So we will discuss compliance and the Office of Inspector General in the Philippines. So when we say compliance, it is an act of conforming or following a law, rule, demand, or request. So compliance is essential to prevent overcharging in a laboratory-based protocol. So this can be overcharging of the patient, Medicare, Medicaid, or the insurance carrier. So sa mga hospital, specifically sa mga private hospital, meron silang specific standard price for the test. So, yung iba sa kanila, naggawagawa ng benchmarking. Pag sinabi nating benchmarking, ito yung kina-compare nila yung price ng ibang laboratory hospital kung tama lang or hindi overcharge yung amount ng isang test or price ng isang test. So, bukod doon, no, para maiwasan natin yung overcharging sa patient or sa mga Medicare nila, sa PhilHealth, Medicaid, or the insurance carrier. Yun yung compliance. So, meron tayong iba't ibang law na sinusunod para masabing tayo ay nagko-comply sa rules stated by the government. So, one law is the anti-kickback law. So, hindi lang to sa ibang bansa, meron din ito sa Philippines. So, ano tong anti-kickback law? So, it prohibits the knowing and willful payment or offer of any remuneration, directly or indirectly in return for inducing, referring, or soliciting service, including laboratory testing paid for by a federal health program. So, ano yung mga example ng mga tao na nagva-violate ng anti-kickback law? So, we will discuss later pala yung Stark law, which is different from anti-kickback law. Though parang pwede mong sabihin na included ang Stark law sa anti-kickback law, mas specific kasi ang Stark law. But we will discuss that later. Pag sinabing anti-kickback law, isang example nito, yung mga pharmaceutical company that is being referred to the hospital as a recommended na medicine na gagamitin para sa mga pasyente. Ibig sabihin, may porsyento sila, may referral fee silang nakukuha kapag nire-refer nila yung mga pharmaceutical company. Ibig sabihin, may kickback sila or meron silang porsyento na makukuha kada refer nila nung gamot sa mga pasyente. Ano pang example? Halimbawa, may mga government laboratories or government hospitals na kumukuha ng mga machines or reagents sa isang certain company. Kasi kapag yung certain company na yun ang kinukuha nila, nagkakaroon sila ng kickback. Kasi pag government hospital, hindi naman mismo yung hospital yung nagbabayad. Ang nagbabayad niyan ay yung mismong City Hall. So, kung galing sa City Hall, galing yun sa government, galing yun sa pera ng mga tao. And then, kung pipiliin nila yung mga company nagpo-provide ng may mga referral or kickback, nakakakuha sila ng percent doon. Ibig sabihin, nakakuha sila ng percent from the money of the people who are paying their taxes. So, yung next natin is our Stark law. So, kung i-compare ito sa anti-kickback law, yung anti-kickback law kasi, kickback siya and referral from anyone. Kapag sinabi ating Stark law, specific siya sa ating mga physician. So, Stark law, by definition, forbids physician from referring sample to laboratory in which physician or immediate family member has financial interest. Halimbawa, yung may-ari ng pharmaceutical company kung saan ginagamit ng physician yung mga gamot, yung nagpo-produce ng gamot, ay kamag-anak niya. O halimbawa, pinipili ng physician na maglagay doon sa pasyente ng gantong mga certain test kasi alam niya na yung laboratories ay nagsisend out sa ibang laboratories kung saan kamag-anak niya yon. So, yun yung start law. Next one is our False Claim Act, where it prohibits knowingly presenting false claim to government. So, prohibits changing billing code, upcoding to increase reimbursement. So, dito sa Philippines, meron tayo nito. And the False Claim Act is introduced by Senator Miriam Defensor Santiago. So, one example of a False Claim Act is, halimbawa, billing for service na hindi naman provided. Merong mga nakalagay na naka-offer na services, pero wala naman pala yung hospital. Billing for the same service more than once. Halimbawa, dinadaya yung may fraud na nangyari. Dinadaya ng mga nagko-compute, ng mga accountant, or ng mga involved dun sa fraud, yung number of tests na ginawa dun sa pasyente. Okay? Kapag naman sinabi na civil monetary penalties law, ito yung pag-exclude sa mga physicians or anyone na nasa staff ng hospital that commits various form of fraud and abuse na nagpapatungkol sa Medicare at Medicaid. So, isang example doon yung kapag kiniklaim nila na may service silang ganito pero wala naman pala. And then, i-charge dun sa patient yung service na ganitong ginawa kahit hindi naman ginawa. So, isang klase yon ng fraudulent act. So, next one is our state laws, which is wala tayo niyan dito sa Philippines kasi wala naman tayong mga states. Ito ay iba-iba, depende sa state kung ano yung pinapatupad na law. Sa Philippines kasi, meron tayong tinatawag na Philippine legal system na mixture ng customary or yung civil law, the common law, and yung Islamic law. Sa mga laboratories, we follow Clinical Laboratory Improvement Act. So, ito yung specification for quality control, quality assurance, patient test management, and personnel and proficiency testing. So, papasok dito yung mga quality controls and yung mga NECWAS, no? Yung mga external and internal controls na mga laboratory. Isa sa mga sinusunod natin for compliance dito sa Pilipinas is yung confidentiality or yung pag-protect natin ng health information ng mga pasyente. So, halimbawa doon, yung HIV testing, dapat laging confidential yon. Kaya in some hospital, they are using codes and number instead of the name of the patient. Ano pa, yung mga drug testing laboratory. Isa yon sa mga nangangailangan ng confidentiality and even kahit anong laboratory diagnosis si patient. Marami kasing mga medtech minsan pinupost online kapag nakakita sila ng kakaibang mga resulta. Halimbawa na lang sa stool exam. No, may nakita silang kakaibang parasite. Minsan, hindi nila tatakpan yung requisition form ng patient kapag nagtatanong sila sa mga online groups kung anong klaseng parasite yon. So, isa yun sa instances ng breaching of confidentiality. Isa pang example nito kapag pinipicturean. Meron kasi tayong law na bawal mag-take ng pictures or video sa loob ng hospital. Maliban na lang kung may consent ni patient or nung medtech or kung sino man nandun sa video yung ginagawa ninyo. Otherwise, pwede tayong makasuhan. We also have Health Insurance Portability and Accountability Act or HIPAA. Some call it HIPAA. So, this one is to protect health insurance coverage for workers and their families when they change or lose their job. So, this is actually a US law. Sa HIPAA kasi, kasama din dyan yung data privacy and security rules ng health information system ng mga patient at iba pang mga laws na related sa healthcare sa ibang bansa. So, every laboratory should have a compliance plan. So, this is to make sure, ensure that they are not outside the law in any of the policies. So, we have 9 elements of compliance plan. So, the first one is standard of conduct. So, this is implementing written policies, procedure, and standard of conduct para pare-parehas kung paano pinaprocess yung mga laboratory tests and processes. Next one is our medical necessity. So, kung ano lang yung kailangan at kadalasang nire-request, yun dapat yung meron. The third one is billing. So, this one is for conducting internal monitoring and auditing. The fourth one is reliance on standard orders. The fifth one is compliance with applicable HHS fraud alerts. Pero tingin ko walang ganito sa Pilipinas. Again, yung compliance plan, hindi siya na-apply sa lahat ng laboratories and hospital sa Pilipinas. Usually, ito ay kinakonduct sa ibang bansa. We also have marketing, prices charged to physician, retention of records, and compliance as an element of a performance plan. Our next topic is phlebotomy-related compliance policies. So first, we have requisition design. So kung mapapansin ninyo, may mga kinakailangan detalye na nilalagay sa mga request form ng lahat ng klase ng laboratories. Say for example, yung name ng patient, hospital number, date to day, yung pirma ng physician as well as yung mga requested na laboratory test. The second one is the client supplies and equipment. So, merong proper guidelines and policies kung ano yung mga kailangang supplies and equipment na dapat meron yung laboratory or machines na dapat meron yung laboratory kung magkakonduct sila or mag-offer sila ng services or mga test na ganito sa mga pasyente. Next one is our courier services. Dito kasi sa Pilipinas, kahit wala yung test na yon sa isang laboratory pero ni-request ni Doc, minsan ang ginagawa nila, pinapadala yung mga sample papunta sa ibang hospital. Sa katunayan, yung mga primary lab, mas malaki ang kinikita kasi kahit wala yung certain test na yon, pinapadala nila sa ibang hospital. Less yung gastos nila sa reagent at sa machine. So, ang nangyayari doon, pinapatungan na lang nila yung test, pinapadala lang nila. Pero ang use talaga ng courier service natin ay kapag pumupunta at nagtitest tayo sa mga mobile laboratories. The fourth one is the hazardous and infectious waste. Ito yung isa sa pinaka-importanteng dapat nagko-comply ang mga phlebotomists. Dapat, say for example, dapat hinihiwalay after nilang mag-draw ng blood yung needle at saka yung barrel. Yung barrel, mapupunta dapat yung sa waste disposal, infectious waste disposal. Yung mga needle or kahit anong nakakatusok, may separate po tayong container doon, yung tinatawag nating sharps container. So, isang example yon ng hazardous and infectious waste policies na dapat sinusunod. So, meron din tayong mga policies like in-office phlebotomist. May mga laboratory kung saan yung kanilang mga physician's office ay may mga phlebotomist na tagakuha ng dugo para convenient para sa patient, para after ni doc i-check up si patient, kukuhanan siya agad ng dugo. And then, ita-transfer yung nakuhang dugo sa main laboratory. So, doon din isang example din yun kung bakit kailangan natin ng courier service, lalo na kung malayo yung physician's office. Next one is questionable test request. And the last one is the release of test information. So, of course, sa release ng test information, dapat ang maaari lang makakuha ng kopya ng result ni patient ay si doctor, yung requesting doctor, yung patient, at yung representative ni patient. Meron din tayong mga medico-legal problems like yung malpractice at yung best practice, which is the opposite of malpractice. So, sa bioethics ninyo, pagdating nyo ng second year, aaralin nyo yung difference ng malpractice, imprudence, and negligence. Pag sinabi kasing negligence, yun yung lack of perception. Pag sinabi namang imprudence, yun yung lack of skill ng patient. Yung malpractice, kapag sinabing malpractice, ito ay medyo similar din kay negligence. Meaning, yung healthcare professional ay gumawa ng hindi naaayon sa standard ng profession nila or hindi naaayon sa policies. Yun yung pagiging negligent or nag-perform siya ng malpractice. So, ano naman yung mga complication of phlebotomy that can result in legal action? So, one example is consent to perform venipuncture. Kaya nga kahit comatose yung pasyente, dapat nagpapakilala pa rin tayo at nagpapaalam tayong kukuha na tayo. Bukod syempre yun sa pagpapaalam natin sa bantay or sa nurses. Second is fainting or convulsing patient. Kapag mga ganitong patient, hindi dapat tayo tumutuloy ng pagkuha. Pinapahupa muna natin, halimbawa na hilo, hindi mo natin agad-agad silang kinukuhaan. The third one is hematoma. Though napaka-rare na case na may magsampa ng kaso dahil sa hematoma, maliban kung gaano kalala yung hematoma. So, probably kasi ang cause ng hematoma mo is kaka-probe mo or kaka-fish mo kasi nga, lack of skill ka sa extraction. The fourth one is the accidental arterial puncture. Though, madalang kasi ang malegal action sa mga ganitong instances kasi ang artery ay hindi maiiwasan, lalo na kung mahirap kuhanan yung patient, hindi maiiwasan na ma-hit natin yung artery kaka-fish. Pero malalaman mo naman agad kung artery yung na-hit mo. Ang importante doon, never kang mag-i-introduce dapat ng kahit anong contamination. Say for example ay air sa artery. Kasi ito yung fresh blood na i-deliver all throughout the body ni patient. So, kailangan mo mas maging maingat. Lalo na kapag nakita mo yung blood na dumadali sa syringe mo ay dark na red or light, bright na red. So, isang example is yung nerve damage. So, yung nerve damage, rare siya mangyari sa phlebotomy. Pero iniiwasan natin din yung usually kasi ang mga ganitong damages, like hematoma and nerve damage, ay dahil sa fishing or unskilled yung kumukuha. So, next one is mislabeled or unlabeled sample. So, ito ay mortal sin ng pagiging isang phlebotomist. Hindi dapat tayo namamali sa pangalan. Kaya dapat nilalagay natin yung hospital number o yung birthday ni patient sa test tubes kasi hindi maiiwasan na sa isang araw may magkapangalan at magkaedad na pasyente pumupunta sa hospital, lalo na kung government hospital yan. Next one is our exposure of the patient to blood-borne pathogen of one another patient. So, maaari kayong kasuhan kung ikaw ay may sakit na at nagtatransmit ka pa lalo ng sakit sa mga pasyente na nakakasalamuha mo. Lalo na kung napatunayan na ikaw yung nagpasimula ng pathogen or outbreak na yon sa hospital. Prevention of lawsuit. So, follow established procedure and practices and be very observant sa patient. Siyempre, kailangan nating maging maingat para maiwasan yung mga ganitong klase ng situations. So, pag sinabi nating ethics, ito yung moral philosophy of acting responsibly. So, it varies by individual, religion, social status, or heritage. So, in performing their job, phlebotomists must treat patients as they would like to be treated themselves. More discussion of Philippine ethics ay didiscuss ninyo pagdating ninyo ng second year. So, nandun, meron tayong iba't ibang klase ng ethics doon. We have bioethics, professional ethics, workplace ethics, etc. So, phlebotomists see many patients at their worst. So, the phlebotomist may find it difficult to be ethical and professional with this patient. So, phlebotomist often has to deal with dying, death, grief for the first time. So, kahit gaano kayo ka-bad trip ng araw na yon, huwag nating pagsusungitan yung ating mga pasyente kasi they have experienced the worst sa stay nila sa hospital na yon. Anyway, kaya naman sila nandun sa hospital kasi may gusto silang ipagamot. So, understand na yung patient na yan, iba-iba yung pinagdadaanan nila, not just yung kung ano yung ginagawa nila dun sa hospital. So, trabaho natin as a medical technologist or phlebotomist to treat the patient as we want to be treated. And that concludes my discussion. Thank you for listening.